And this is your opportunity to ask her anything you want. We'll be here for about 30 minutes. You're welcome to come and go as you please and ask questions. We are pretty sure it's recording. This is a new feature. So hopefully it's available for replay afterwards. Mary, I think you had a couple questions that you saw come through the chat originally. And guys, as Mary talks, feel free to ask your questions. This is your opportunity to get them answered by someone who's very knowledgeable in thyroid and hormonal health. So Mary, I'll let you take it from here.
Great. Thanks, Katie. I love doing these Ask Me Anything because there's so many questions that come in all the time. I get them constantly by email, by text, by instant messaging and such. But we had a few people that left some questions in our community. And I also had some people that direct messaged me some questions in advance. So I think we'll go ahead and get started with those. And again, feel free to include any additional questions that you might have in the chat. Katie's going to be keeping track of those and making sure that I get to them. So let's go ahead and get started. So we had a question from Richard on the community, and Richard said that he was on levothyroxine as of March this year. And he wants to know about ways to find and reduce the causes and rid his body of the antibodies that attack the thyroid. So we're assuming Richard has Hashimoto's because that would be consistent with having antibodies and being hypothyroid and needing levothyroxine. So when we're talking about the autoimmune form of hypothyroidism, Hashimoto's hypothyroidism, we're really talking about the vast majority of people who are hypothyroid in the United States, because that's the main way people in the US become hypothyroid. And so what we're looking at there is the immune system is inappropriately and sometimes inexplicably attacking our own thyroid gland. And so what are some of the things that we can do about that? Well, one of the first things that we can do is to get proper diagnosis and treatment. So Richard's first step of starting the levothyroxine is actually a very good first step, because there is research that shows that treating someone with elevated antibodies can in some cases start to lower the antibodies. It's calming the thyroid down, supporting the thyroid, and it can sometimes calm down the autoimmune attack on the thyroid. But it's not necessarily a foolproof all-in-one solution, because it doesn't always get rid of antibodies or significantly lower them enough. Then we go into some other things that have been shown to lower antibodies in some people. Keep in mind, it's not a one-size-fits-all. It doesn't work for everyone, but certainly the autoimmune protocol diet, the AIP diet, can, in many cases, lower antibodies by removing inflammatory foods and inflammatory processes from the body. We can lower the inflammation, lower the autoimmune attack, and in some cases reduce antibodies. And in some cases, people really will report a great improvement in their symptoms as well. Even people who are very mildly hypothyroid with Hashimoto's or borderline hypothyroid with Hashimoto's, but who have a lot of symptoms, they go on an AIP diet, and it's amazing. They have energy, they lose weight, they feel well, the inflammation, the bloating, all of these symptoms will resolve for them in many cases. So little plug here, if you are trying to follow the AIP diet, it can be a little bit complicated. And so the Paloma app, which is available on both iOS and Android, is a really great free tool to help you follow that diet more closely and help you stay on track. We have food information, we have recipe plans, there's all sorts of information to support you in the AIP diet if that's an approach that you decide to take. There are some other things that many of the integrative doctors that we work with at Paloma, that can be your doctor if you're working with Paloma, also do, which is in some cases, they will recommend that you supplement with some selenium. And selenium has been shown to help reduce antibodies in some cases. So selenium supplementation can be helpful. But keep in mind with selenium, this is one of those, I tend to call them the Goldilocks supplements or the Goldilocks solutions, because too much is not good, too little is not good. So with selenium, you want to stay under 400 micrograms a day. Too much more than that, and you can get into selenotoxicity or toxic selenium levels. So unless you're eating a lot of Brazil nuts, which is the primary source of selenium, from dietary reasons, you want to check all your sources of selenium, supplements, multivitamins, etc., and make sure you're not going over 400. Ideally, you should aim for around 200 micrograms a day, and that in some cases can reduce antibodies. And then finally, another solution for some people has been the use of low-dose naltrexone, also known as LDN. This is a prescription medication that is prescribed at very low doses, and it has been shown in some cases to help reduce autoimmune antibodies in not just Hashimoto's, but a variety of autoimmune conditions. And many of our Paloma doctors are familiar with LDN and will prescribe it. And it tends to be something that you'll get more understanding and willingness to talk about from more integrative and holistic doctors rather than your general GP or someone that's not particularly familiar with thyroid or autoimmune disease. So hopefully that gives you a good overview rundown of some of the key things that you can be doing with helping to lower your antibodies. We also have a number of articles at the Paloma blog that where you can learn more about lowering your antibodies. So I would suggest you take a look at some of those as well. Okay, I'm going to go on to question number 2, which came from Sally. And this was also on our community. And if you haven't visited the community, you may be new to the community and just signed up in order to join this Ask Me Anything. But our community is really growing, and we've got a lot of really passionate, informed, and interested thyroid patients who are really excited about sharing information, knowledge, support, compassion, experience, tips and tricks, or sometimes just looking to validate their own experience. So it's free. So we invite you to join our community and jump into the conversation. Katie is there regularly sharing information. I try to pop in when I can to share information as well. And there's lots of thyroid patients who are actively exchanging information and getting support. All right, so Sally's question from the community: what is the cleanest sustained release T3 aside from compounded T3? When I say clean, I'm referring to fillers such as gluten, corn, soy, and also porcine gelatin. So this is a little bit of a complicated question because there is the only sustained release T3 that we have right now is compounded T3. We are, fingers crossed, waiting for a new drug that should be getting approval, hopefully in 2022, maybe 2023, called Polyzinc Liothyronine, or PZL. And that would be the first manufactured sustained release form of T3, liothyronine, which is a additional hormone that some people take on top of levothyroxine. So it's the T3 hormone to help smooth out and even out thyroid levels and provide that active hormone. But until we have PZL, Polyzinc Liothyronine, we are looking at the only options for sustained release, for a slow release T3 coming from compounded pharmacies. Of course, there are T3 tablets. You can get Cytomel or generic versions of Cytomel, but they are not slow release or sustained release. They're fast release, which means within a few hours, they reach their peak and then they drop back down to baseline levels. So the benefit of having a sustained release T3 is that it releases so slowly that it's like your regular thyroid gland and it's mimicking it. And so many people who are taking T3 prefer that form because it doesn't cause any peaks in their T3 level, which can be overstimulating for some people. I've had some patients that have told me when I've done coaching with them, they've said, oh my gosh, if I take a Cytomel tablet, within an hour or two, I feel like I went to Starbucks and just downed 3 triple espressos because they just feel so hyped up and buzzed. And when they switch over to a sustained release T3, it's amazing. All of a sudden, it's like a steady, low, sustained level of energy that doesn't make them feel overstimulated or caffeinated or whatever. It just keeps them steady. So there's a significant benefit to it. But when we're talking about compounding, we're also talking about a lot of pharmacies out there in the country, and they do things differently. So some pharmacies will use all sorts of fillers in their compounded medications, not just T3, sustained release T3, but all different kinds of medications. So you may see gluten, You may see corn, you may see soy fillers, you may see different gelatins that are made from animal proteins. So the question really for Sally is, you need to be working with a compounding pharmacy that you like and that you trust, and who will give you full disclosure on all of the ingredients. And a good compounder will have this conversation with you. What is the capsule made of? What is the filler that you're using? Are there any other ingredients that you're using as desiccants or drying agents or binders or anything else? What is in my capsule? And a good compounder will tell you exactly what's in your capsule and allow you to work with them to find out if there are any ingredients that are problematic for you. And a great compounder will say, hey, if you're allergic to X, Y, or Z, we will substitute something else that isn't going to aggravate your system or bother you. So hopefully that gives you an answer, Sally, in terms of your question, because there really isn't any option except for compounding pharmacies, but the choice that you have is to choose to work with a good compounder who's willing to give you full disclosure on what the ingredients are. And I know some compounders that actually, they only use a releasing agent, something that slows that release, and they use it a capsule that's as natural as possible, usually made from some sort of simple gelatin, and they will tell you exactly what's in it and make sure that it agrees with you and doesn't aggravate any sensitivities or allergies or problems. So there should be some options out there for you. All right, so I had a question that was sent in by Gabby, and Gabby wants to know, why would I want to get a reverse T3 test? And this is an interesting question because a lot of thyroid patients are very familiar with the TSH test, the thyroid stimulating hormone test. That's the test that's measuring that pituitary hormone that is the messenger hormone. When the TSH goes up, that means it's telling our thyroid, make more thyroid hormone, make more thyroid hormone. When the TSH drops down, it means the pituitary says, oh, she's got enough thyroid hormone. I'm going to tell her to slow down. So I'm not going to tell her and yell at the thyroid with that TSH, hey, make more hormone, make less hormone. So it's basically a messenger. It's sitting there. It's got the megaphone telling you when to start making more hormone and when to cut back on making hormone. But the actual hormones in your bloodstream that reflect the situation of what's going on in your thyroid is the T4 and T3. T4 being the thyroxine and the T3 being the liothyronine. Well, that's liothyronine, triiodothyronine. Liothyronine is the medication version of T3. So the triiodothyronine is the T3 hormone. And T3 hormone is the active hormone at the cellular level. But here's an interesting kick, and this is something that a lot of people don't know, and a lot of doctors don't really discuss with patients because it's less understood among general practitioners or GPs, you know, your primary care doctors. It is something that is, however, very well understood by thyroid doctors and people who work with thyroid every day, like our Paloma doctors. So when you're talking about T3, T3 goes to your cells, tissues, organs, and glands and binds to receptors. And then it sort of is the key in the door that unlocks the ability for oxygen and energy to help reach all of these cells, tissues, glands, and organs. And everything in our body, from our hair to our toenails, requires T3 to reach our cells and tissues in order for the energy to reach us. Our brain, our heart, our digestion, every organ function, it all relies on getting that active thyroid hormone as part of our energy process. But when our body's under stress, whether it's physical stress from nutrition, lack of sleep, infections, inflammation, or whether we're under chronic life stress, difficulties at home, just angst about things, whatever is going on physically or in an emotional sense, we can get into a pattern where the body starts to do something called producing reverse T3. So T4 has to convert into T3. It has to lose that fourth molecule of iodine to become T3. I often use a really goofy example when I'm coaching, but people have actually said it's helpful as an explanation. T4 is like the box of dry cake mix on your counter. Now, it's perfectly useful box of cake mix, but you're not going to eat the dry box of cake mix. You have to put it in a bowl, mix it up, and bake it into cake before you can eat it. Well, T4 is the cake mix. T3 is the cake. We have to transform T4 into T3 in order to make it usable by the body. We have to convert that cake mix into cake before we want to eat it. So what happens is during that conversion process, when we're under stress, physical or emotional stress, some of that T4, when it's going through that conversion process, gets waylaid and it becomes something called reverse T3, which is a form of T3 that's a mirror image of T3 from the purposes of fitting into the receptors, but it doesn't unlock. It's like a key that fits in the lock, but you jiggle it and you can't turn the key. You can't turn the lock. It won't open it, but it fits in the lock perfectly fine. Looks just like the other keys, just won't unlock the door. So this T3 gets into those receptors, this reverse T3 gets in and it blocks the real T3's ability to get into the cells and deliver energy. The problem is the reverse T3 is counted. When we're counting T3 in our regular thyroid panel, it's going to get counted in. So it's sort of, sometimes I know I'm using a lot of metaphors, but sometimes it's helpful. It's rocks in the gas tank. It's taking up space, but it's not doing anything. And we don't really, when it's counted in our thyroid levels, we'll say, oh, our T3 looks good or even optimal. But if you find out you have very high reverse T3, that sort of brings it down a little and says, hey, maybe my T3 levels aren't quite as good as they should be. So we measure reverse T3 as a way to get a really clear fix on what level of that inactive blocking form of T3 our body is producing. And when those levels are in the upper end of the reference range or elevated above the reference range, that tells us that we are stuck in a pattern of producing way too much of this reverse T3 and that it's time to take action. And again, this is something our Paloma doctors do routinely, which is to look at that reverse T3. And if patients need it, they're going to add a little bit of extra T3 to their thyroid hormone replacement. They're also going to look at a variety of approaches that may be able to affect the stress level in the body. They're going to look at dealing with infections, stealth infections, other kinds of problems that may be there, nutritional issues, shoring up nutrition, shoring up all of the different things that need to be dealt with, and helping make sure that you're getting sleep and all of the things you need to heal your adrenals and get them under control so that you can get that reverse T3 level down. So that is why we would want to get a reverse T3 test. Now, with our Paloma home test kit, that test kit, the basic complete test kit, includes TSH, free T4, free T3, and thyroid peroxidase antibodies, or TPO antibodies. But we do have an optional add-on when you're at the checkout to add in a reverse T3 test, and it's very inexpensive to add that on as an addition to your panel. You can also add on a vitamin D test, and that's a very useful test as well. But that gives you hopefully an overview, a good idea of why we have reverse T3 testing being done by some doctors who are really knowledgeable about making sure that hypothyroid patients are getting comprehensive treatment. So I had a question from Tom, who said, what's the difference between T4 and T3? And so in a sense, I've kind of answered that to some extent with the previous question, but just to recap, T4 is thyroxine. That is the thyroid hormone that has 4 molecules of iodine. And when we have a functioning thyroid, when our thyroid is working perfectly and doing everything it needs to be doing, the majority of the hormone that the thyroid is producing is going to be T4. So I think depending on what you're looking at, about 80-20, 85-15, but the majority of it's going to be the T4 hormone. A smaller percentage is going to be the T3 hormone. But the T4 hormone that is being produced has only one role in the body, and that's to be turned into T3, because T3 is the active hormone that at the cellular level goes to those tissues, organs, glands, and cells throughout the body to help that energy get into those cells to power them and function them. So the T3 is the thyroid hormone after it's lost that one molecule. That's the process of T4 to T3 conversion. That's that turning that cake and cake batter and cake mix into a cake. So the most important thing for a lot of thyroid patients is to be aware of what those free T3 levels are. And this is why it's so interesting to me as a thyroid advocate for more than 20 years. I have talked to, I can't even count how many thyroid patients who said that their doctors only test their TSH levels. And in my opinion, that is a real oversight, because that is measuring a pituitary hormone. It's not giving us a picture of what's actually going on at the cellular level in our bloodstream with our thyroid hormones. So to me, to not include free T4 and free T3 is really ignoring a big piece of the puzzle. So that's why I'm excited that a good, thorough thyroid panel is always going to include those things. And certainly our home test kit includes that as well. And if you go to a good doctor anywhere that understands thyroid, they're going to always order a free T4 and a free T3 in addition to the TSH. Okay, I have a question from Ellison about, is there a difference between the different brands of levothyroxine? And that's actually a good question, because the majority of thyroid patients with hypothyroidism are taking levothyroxine, which is the synthetic form of the T4 hormone. And but I'm not going to say that there aren't other options, because there are. We have a lot of patients that also prefer natural desiccated thyroid drugs, porcine thyroid. So this is not the only option, but it does reflect the majority of patients' treatment options is usually in the levothyroxine. And that's what most doctors will start patients with as a first line therapy. So when it comes to levothyroxine, people think it's sort of this generic category, and there's just all of them are the same, and they really aren't. That's what's interesting. We have levothyroxine tablets, which are made of normal tablets. My dog is being crazy here, so I got to tell her to sit down. Sit down, you. We have levothyroxine tablets, and there are brand names and there are generics. So when it comes to our tablets, we have Synthroid, we have Levoxyl, we have Unithroid, and we have Euthyrox. And these are the brand names. Unithroid and Euthyrox tend to be fewer excipients, fewer fillers, fewer coatings. So they're a little bit cleaner for some people who have some sensitivities. Obviously, Synthroid, extremely well known. A lot of people know it and rely on it. Levoxyl's been around for a long time, another popular tablet form. But then we also have numerous generic manufacturers making levothyroxine as well. There's Mylan and Teva and all these other companies. You may not even know, if you're taking a generic, who the manufacturer is. Sometimes they'll list it on the bottle. The issue, and they're all good drugs. The key is that particular drug, that generic or that brand, good for you? And the answer there is the best thyroid drug for you is the one that works best and safely for you. So some people might find that an ingredient in Synthroid causes sensitivity, but they can take Euthyrox without any problem. Or they may find that they don't really respond well to Levoxyl, but they take Synthroid and they feel great. So we always want to make sure that people understand that there's no sort of hierarchy of what's better or what's worse. The issue with generics, however, is that every time you go to get a refill, you can get a different thyroid manufacturer. So, and there can be some variation in potency. So if I go this month and get a refill and it's Teva, and then I go next time and get a refill and it's Mylan's generic, there could be as much as up to a 10% variation in potency, because it can go from 95 to 105% of the stated potency of a dosage. So when we're talking about a narrow therapeutic range drug like thyroid, that's a variation that a lot of people aren't willing to put up with, especially if you're managing during pregnancy and you have to keep your thyroid very controlled, or you're a thyroid cancer survivor who needs to keep your thyroid suppressed, or you're simply very sensitive to even tiny fluctuations in your dosage. So for people, for the most part, we recommend sticking to one brand, or if you have a great pharmacy or you're working with one of our friends out there who do mail order pharmacies and allow you to specify the generic, or you have a local pharmacist who's your buddy who says, hey, I'll always make sure I get you the same manufacturer, then you can safely take a generic levothyroxine tablet. Now, in the levothyroxine area, there's also another option, and a lot of people aren't as aware of it, or when they do hear about it, they're afraid to even think about it because they think it's too expensive, and that's Tirosint. Tirosint is a liquid form of levothyroxine, and it comes in two forms. It comes in a capsule, gel capsule, and it comes in a liquid that is in, it's like those little plastic eyedropper applicators, the one-shot eyedroppers where you have pop off the top, you put the eyedrops in, and then you throw it away. It comes in a little ampule like that. That's a one-dose delivery. You pop it off, you put the liquid in your mouth, throw it away. And it is the cleanest form of levothyroxine. It has almost no fillers or excipients or extra ingredients. It was specially formulated originally for people with ulcers, gastric problems, absorption issues, celiac disease, irritable bowel syndrome, gluten sensitivities, all the sorts of issues that can make it difficult for people to absorb a typical tablet with levothyroxine. So it is very highly absorbable, and it's very effective for people who have absorption problems or otherwise have difficulties with absorbing their thyroid medications. The retail sort of cash price of Tirosint is very high. It's over $100 for a month's dose. However, a lot of people have said, their doctors will say, well, I'd give you Tirosint, but it's too expensive for you. But there's actually programs that Tirosint has, and you can check at their website for $25 copay coupons for people who have insurance. And for uninsured patients, they have a Tirosint Direct program where you can order it from a mail order pharmacy and get it for no more than $25 to $40 a month payment. So it makes it more affordable. And for those people who need it, it can be a real lifesaver. So let's see. I have one more question, I think, before we wrap up. And this is a question from Julie. Yeah, Julie. And she wants to know, what's more important, my TSH level or how I feel? And she said, my TSH is 3 and I feel really great, but I keep hearing about how I should be optimal and should my TSH be lower? And this is really an interesting question because it's kind of the opposite of a lot of the questions we usually get, which is, well, my TSH is fine, but I feel terrible. My doctor won't do anything about it. Here is a situation where she's higher, has a higher TSH than maybe what we might think of as optimal, because a lot of doctors and patients would consider optimal TSH to be in the maybe 1 to 2 range. And so patients who would be at 3 or 4 or higher and said, I'm not feeling well. Well, you know, a lot of doctors would say, well, let's try upping your dose slightly to see if that helps resolve your symptoms and get your TSH down a bit more closer to the 1.0, 1.5 range. But in this case, she's saying, hey, I feel fine and my TSH is 3. Does it need to be lower? And the answer there is no, because ultimately we all have a set point where we feel our best. And that is unique. It's not necessarily what the TSH where I feel fine is not necessarily the TSH where you feel fine. And it really is a combination of looking at both the numbers and your symptoms. Any good thyroid doctor is going to always take your symptoms into account. So if you have a TSH of 4 or 5 and you don't feel well, that's a sign that they need to be doing something. Similarly, if your TSH is way too low and you're over medicated and you say, I'm feeling frazzled, your doctor should be cutting back on the dose. They should be using your symptoms along with your levels, as long as you're within a safe range. And in this case, Julie's TSH is in a safe range. She happens to feel really well at a 3. It may not be the 2 or below that some people would consider optimal, but if it's optimal for her, that's the most important piece of the picture. So, you know, I've always said my rallying cry is we're patients, not lab values. And a good doctor is going to always say, how do you feel? And they're going to do whatever they can safely and effectively to optimize how you feel. The numbers may be part of the picture, but they're not the whole picture for us. So thank you, Julie, for that question, because that was a good question, because it kind of allows us to sort of explore the bigger picture of what good thyroid care really is. So I think that probably wraps up our questions for today.
Can we lob one more question to you, Mary?
Absolutely. Absolutely.
Okay. Sally's asked, it was piggybacking off of a previous question you answered, but Sally's asked, aside from compounding in capsules, what are the cleanest T3 meds, as in least amount of fillers and dyes? Also, what do you think about compounded oral T3 suspended in Unispend?
That's interesting. I think, any one of those things, any form of thyroid medicine, if your doctor's working with you to recommend it and you're working with a good compounding pharmacy, can be effective. So what do I think about it is probably, I haven't heard bad things. I haven't heard lots of people saying, oh yeah, I'm using the suspended form and it's really, the solution for me. I mean, there's even people who don't metabolize T3 very well and they get T3 put into creams and they rub it onto their fatty tissue on the thighs and skin, like a progesterone cream almost. So really, to me, it's the question, it's the proof is in the pudding. If it works for you and you're safely managing your treatment and your doctor's overseeing it and recommending it, and you're working with a trustworthy compounding pharmacy, because let's face it, some of them are wonderful. There's some amazing compounders out there, but there's also some that cut corners and that aren't as responsible as they should be. And, they give the other guys a bad name. So I always feel like go to the good compounders. Your doctors will know who they are because they are going to be working with them on a regular basis, and make sure you're getting the good information, but try different things. That's one of the sort of surprises of thyroid for a lot of people, is how much it's a trial and error process. I mean, you think about something like, I have a headache, so I take some Advil and my headache goes away a couple of hours later. Well, thyroid is not quite so clear cut. You're hypothyroid, so you take a pill and your hypothyroidism goes away. Not quite so easy. That's why we have multiple different kinds of medications, and we have compounded versions, and we have natural thyroid, and we have people on, T3, T4, and natural thyroid. We have every possible permutation. It's like a giant recipe book of all the different options. And there's no one size fits all. If you're a 50-year-old woman who's hypothyroid from Hashimoto's, this medicine will be the best choice for you. We don't know that. It sometimes is a good guess as to what might work. And then we have to tweak it, try it, start over with different meds, adjust things to get to the place where you're going to feel your very best. So I think we might want to, Katie, we may want to throw that one out to one of our Paloma doctors at some point to get a little bit more in-depth medical opinion on that, because there may be some specifics from the doctor's perspective that I'm not aware of. But my philosophy about any questions about thyroid medications is, if it's actually prescribed by a doctor and given to you by a legitimate pharmacy, then the question is, does it work well for you safely? Because then it's good. Then it's a good drug. And it doesn't matter who made it, what the brand is, whether it's a generic, it's a good drug if it works safely and well for you.
Awesome. Thanks, Mary. Just toggling our view here. Thank you so much for answering all of those questions. And like we said, folks, we will have this available for replay as long as there's no technical glitches. This is our first time trying the record option on this platform. We'll have it available for replay. So if you missed your question or want to go back and listen to any of Mary's answers, that will be available for you. And we plan to start doing these Ask Me Anythings both with Mary and some of our provider team on a regular basis. So you will continue to be able to ask your questions about hypothyroidism and Hashimoto's and hormone health. So thank you all for taking the time to be here. Thank you, Mary, for all of your insight and wisdom and knowledge. We hope you guys have a great Wednesday, and we'll see you soon.